Did you know that 2.3% of the U.S. population, which is 1 in every 40 adults and 1 in every 100 children, is diagnosed with obsessive compulsive disorder? I got that fact from beyondocd.org. Obsessive compulsive disorder is an anxiety disorder characterized by recurrent and disturbing thoughts, which are called obsessions, and repetitive actions known as compulsions, and they are performed until the person is mentally satisfied and the anxiety is extinguished. One usually develops OCD at an early age, and it is normally passed on from parent to child. Obsessions can range from persistent and uncontrollable thoughts, impulses, and images that are highly unwanted and can sometimes be very disturbing. Most people with OCD realize that these thoughts are irrational but can't escape them for some time. Thus, the person feels the need to complete the tasks until some sort of relief is attained. Common compulsions that most OCD patients suffer from are frequent washing of the hands, touching or grabbing objects, counting, constant cleaning, organizing, double checking, doubting, which is the fear that if something isn't a certain way they will be punished for it, and finally hoarding. Now let's check a few statistics that I got from our class survey. Based on the survey results, 70% of the students who took the survey claimed they had OCD tendencies. 80% found themselves double checking things that they already knew were fine, and lastly, only 40% said that they would seek medical help, which now brings us to therapy for OCD. According to helpguide.org, there are a couple common therapy methods for OCD patients, and one method is called exposure and response prevention. Exposure involves repeated exposure to the fear or obsession to the patient. Then the patient, accompanied by a therapist, is asked to not perform the behavior that is usually performed to extinguish anxiety. Constant exposure to the obsession without being allowed to execute a response will slowly but surely relieve the patient from feeling the need to perform the task. Another therapy method is cognitive therapy. Cognitive therapy focuses solely on the unwanted thoughts and responsibility of the patient. Cognitive therapy teaches the patient healthy ways to respond to the obsessive thoughts without resisting to compulsive behaviors. If there are any positives to take away from this, it's the fact that there is help available. Whether it be self-help methods, which many of you said you would resort to if you found out you had OCD, or professional medical help. There is plenty of doctors at your disposal and medical professionals available. I hope this speech gave you a new outlook on OCD, its symptoms, and its treatments, and I hope I have given you plenty of information that you can pass along to a friend or loved one who may be suffering from this disorder as well. With help, this disorder can be controlled and extinguished from the lives of OCD patients, and people can go back to living an obsession-free and compulsive-free life.